Hello, my name is Kelly Klingo, and I will be speaking on the application and validation of nano-composite wearable technology for studying lower back pain. I will begin by explaining why chronic low back pain is a subject worthy of study. Chronic low back pain, or CLBP for short, is defined as pain in the lumbar region of the back that persists for a minimum of 12 weeks and can cause enduring perpetual pain throughout the lives of those afflicted. It is one of the most common sources of chronic pain and disability, and practitioners have an exceptionally difficult time diagnosing, communicating, and addressing its various causes. Because of this difficulty in diagnosis and treatment, the suffering due to CLBP has many downstream consequences, from sick days to draining healthcare systems, even to potential abuse of prescription medication, since CLBP is one of the most common ailments for which opioids are prescribed. According to the CDC, almost 50,000 people in the United States died from opioid overdoses in 2019, with prescription opioids being involved in nearly 1/3 of those deaths. Thus, reducing the number of necessary opioid prescriptions is a natural goal. Many deaths and much suffering can be avoided by improving access to methods for practitioners to communicate and understand spine motion associated with specific pathologies, enabling them to make better surgical treatment and rehabilitation decisions for patients with CLBP. A quantifiable, transferable system of characterization of spinal dysfunction is needed. Magnetic resonance imaging, or MRI, is currently the diagnostic tool of choice, but it is problematic for multiple reasons. First, patients cannot move during the scan, preventing practitioners from precisely identifying the pathology a dysfunctional movement might indicate. In addition, patients lie flat on their backs, which is often the least painful position. Since movement can be correlated to spine health, this is the least informative position for those trying to find the cause of CLBP. A solution to the current diagnostic and treatment limitations would require utilizing patients' movements. Because dysfunctional movements can identify specific pathologies, it follows that the dynamics of spinal motion should be utilized in the diagnosis process. It has been observed that when one moves the spine, the skin deforms accordingly, suggesting that skin strain data can serve as a proxy for actual spinal motion. It follows that skin strain can be used to identify specific pathologies associated with CLBP. The objective of this study was to optimize and exploit nano-composite strain sensors for extracting skin strains of human subjects during everyday activities and using those skin strains to characterize spine motion. Artificial intelligence has enabled the biomedical application of silicone-based sensors in lightweight, wearable, flexible systems that can monitor patients' movements. Thus, a wearable sensor array composed of strain gauges was manufactured for application to CLBP treatment. These flexible nano-composite, inverse piezoresistive, silicone-based sensors can be resistive or capacitive and have been used to measure pressure and strain. Their distribution and relative orientation were previously modeled to determine the optimal design. In previous work, these strain gauges were used to identify sitting posture with 98.75% accuracy and correctly measure bovine ligament strain more efficiently than optical marker tracking. In order to validate the wearable sensor array as a whole, electromagnetic tracking, marker-based motion capture, and inertial measurement units were used simultaneously with the sensor array to measure vertebral kinematics on cadavers as they were manipulated to perform exercises chosen to represent functional movements of daily life. I will now discuss the methods for manufacturing, designing, and validating the wearable sensor array, as well as a brief overview of how the sensors work. As you can see in this plot, when the sensors are strained, the impedance visibly drops. Hence, the drop in impedance can be used to obtain information about skin strain and relative spinal movement. At the 60% strain shown, the sensor is stretched more than is typical for skin. The nano-composite strain gauges were composed of silicone, nickel chemical vapor deposition coated carbon fibers, nickel nanostrands, catalyst, and surfactant at the weight percentages listed. The electrostatically clumped NCCF were gently separated using a custom pepper grinder made of PVC pipes with attached screens. A paste was made by measuring out the various components, combining them one by one, and placing the mixture at each step in a centrifuge. Copper wire was sewn into an elastic sports tape substrate using a multi-step zigzag stitch on the sewing machine to provide the wiring for the array. The ends of the wires were then exposed at the interfaces with each of the 16 sensors. A spatula was used to scrape the paste into laser-cut polycarbonate mold placed on the kinesiology tape, engulfing the exposed wires. The sewn kinesiology tape and paste-filled mold were placed in a vacuum-sealed bag and placed in the oven to cure. Once cured, the mold was removed and the sensors were pre-strained to 50% to reduce hysteresis and preconditioning effects. To determine where the sensors should be placed within the array, skin deformations were correlated to spine biomechanics. Reflective hemispherical markers were placed on the lower backs of 30 subjects, and Qualis's motion capture gathered positional data while these subjects performed 17 exercises representing functional movements of daily life and non-functional movements typically used for evaluation. These specific movements were then correlated to locations of maximum epidermal strain. This correlation was used to determine the optimized length and orientation of the sensors within the array. To validate the sensor placement, 3 cadavers, first a trunk, followed by 2 full-body cadavers, were suspended in a harness and manipulated by researchers to perform 10 exercises for 7 repetitions, while outfitted with the wearable array with the motion capture markers adhered and electromagnetic tracking sensors and inertial measurement units, which were attached to bone pins embedded within the spinous processes. A hammer whose rubber head was attached to a motion capture marker and wires connected to a battery was used to strike one of the sensors at the beginning of each exercise to close the battery circuit, increase the voltage, and thus synchronize the data between the various measurement methods. Our initial work has proven to be very promising. As you can see in this figure, you can see how the sensor's impedance changed in response to cyclic strain in an alternating tensile test. Here, the impedance response to change is clearly visible, with the second number in each callout being the impedance reading. This is the impedance response of a single sensor while it's undergoing motion. The sensor array output gain versus time, in which the peaks in the figure on the left represents repetitions of each exercise, in this case flexion as performed using the second cadaver. This data was passed through a 0.3 Hertz filter. The figure on the right displays the array with each sensor numbered for easier correlation with the figure on the left. The IMU output Euler angles versus time, as seen in these plots. They display the rotation of the T12 spinous process relative to its starting position along 3 axes as the third cadaver was manipulated to perform 7 repetitions of flexion. An IMU was only used in testing performed on the third cadaver. The IMU contained an onboard Kalman filter. The electromagnetic tracking output the relative angles between adjacent sensors. Each of the 6 sensors was attached to a bone pin inserted in the spinous processes from S1 to L1. These plots illustrate the relative angles between electromagnetic sensors attached to adjacent spinal processes as cadaver 1 was manipulated to repeatedly perform flexion. The MATLAB code written for the motion capture data converted the positional data into angular deflection in 3 axes between adjacent reflective markers adhered to the spinous processes from L4 to T11. These plots display the angular displacement between adjacent spinous processes as measured by motion capture as cadaver 1 was repeatedly manipulated to perform flexion. To interpret sensor strain data relative to the kinematic data, a time correlation between activity and strain measurements was performed. The top 2 plots represent the strain measurements between L1 and S1 as cadaver 2 was manipulated to perform 8 repetitions of flexion, with the time adjusted to better correlate to the strain sensor data, as there was a delay between starting tests due to delay in human reflexes. The below plots indicate the strain gauge measurements. Each orange line represents the peak of flexion for each repetition and helps show the time correlation between activity and strain measurements. To reach the future goal to use the sensor array to identify specific CLVP pathologies during daily activities, the array first had to be used to identify the movement being performed. To accomplish this, the sensor output plots were visually analyzed to identify which sensors were activated for specific exercises. The sensors which exhibited strong pattern correlation with the applied kinematic exercises are identified in each panel of this figure. These images highlight the sensors activated for each exercise. The strong pattern sensors are those that display a clearly visible gain change pattern for the associated motion. The weak pattern sensors had a less obvious correlation between gain and movement. The predicted pattern sensors had little to no visible pattern, but are assumed to mirror the visible pattern observed during movements performed on the other side. While the results of this testing were promising, there were some limitations. The sensor array was far more effective during the testing performed on the second cadaver compared to the first and third cadavers. The peaks occurred as predicted, but some sensors took over a minute in some cases to recover from the residual noise of the hammer strike. Other sensors were unaffected by the hammer strike. Overall, the sensors with the greatest change in gain were those oriented in the direction that intuitively corresponded to the greatest strain for each specific motion. Movement, inflection, and extension was the most easily discernible, while axial rotation and lateral bending were harder to distinguish. The most significant limitation of this study was that the cadavers all had significant skin laxity related to weight loss immediately prior to death for the cadaver subjects. This is not anticipated to be a significant concern for the bulk of live subject testing. The average gain for the testing of the third cadaver was relatively high, with little observable change due to strain. Cadaveric specimens with less epidermal laxity would enable the sensor array to respond to epidermal strain more effectively. In addition, an alternate synchronization method to the voltage-inducing hammer would lessen the noise exhibited in the sensor gain outputs. Much progress has been made since the time of the cadaver testing. The manufacturing process has been streamlined by utilizing an automated embroidery machine, reducing the sewing time to less than 20 minutes. An array is shown at the top right attached via a mini HDMI cord to the custom PCB battery system, which communicates via Bluetooth with a nearby smartphone. The raw material cost of the entire system, including the PCB, can be as little as $23 at large quantities. The screenshots of the user interface for the iOS smartphone app can be seen at the bottom of the slide. From left to right, you can see the startup screen, demographic profile, diagnostic exercise selection, example video, and triggering of data collection. At the top left of the slide, you can see the evaluation of the sensor array prototype and associated iOS app using the system usability scale. A score of 68 or higher represents an above average design. After implementing machine learning, our sensor array achieved an average accuracy of 96% for predicting exercise type using a random forests approach and an average categorization rate of healthy versus symptomatic spine motion of 99% using both k-nearest neighbors and random forests algorithms based on our recent live subject testing. All this evidence and more illustrates that our nano-composite wearable sensor system is affordable, accurate, and easy to use. For more information, I would recommend Andrew Gibbons' presentation on another method of validating our wearable sensor system. Research funding for this work was provided by the National Institutes of Health as part of the Backpack Consortium of the HEAL initiative. Thank you very much.